Welcome to the CPC On Demand Learning Series. I'm Dr. Russell Cole, Medical Director at TMF Health Quality Institute. Today's topic is creating and sustaining a culture of improvement in your practice. The speaker for this presentation is Christy Brownfield. She is the Quality Manager for Harrison Family Practice Clinic. This small rural practice is in Harrison, Arkansas, in northwest Arkansas near the Ozark National Forest. Christy's husband, Dr. Shannon Brownfield, is the physician in this hospital-affiliated practice.
Hello, this is Christy Brownfield from Harrison Family Practice in Arkansas. In addition to Dr. Brownfield, our practice has 2 advanced practice nurses, 2 RNs, an LPN care manager, as well as an X-ray technician, lab technician, and 5 office support staff that serve our 2,800 patient practice. I have been asked to share our story and strategies for creating and maintaining a strong culture of improvement. Several years ago, our entire team was challenged to embrace change. Toward the beginning of CPC, Dr. Brownfield brought the team together to discuss the fact that the field of medicine and healthcare was evolving. Change or continuous quality improvement was becoming essential to both meeting complex needs of our patients and also for remaining sustainable and competitive in the healthcare environment. Our motivation for embracing change comes from improving care and care coordination of our patients, as well as sustaining the business and our livelihoods. To create a culture of change, quality, and improvement, we needed to first accept as an organization that healthcare is changing and that we are moving to a system that recognizes and rewards quality. We recognized that the whole team needed to embrace this to survive and to thrive. So we made change is the new normal a sort of mantra. As part of CPC, we have heard of many different strategies and approaches that other practices have adopted, and one thing that we've learned is that you have to make choices and create systems that work for your team. We're a small rural practice, and this can create challenges, but it also comes with advantages. In general, we are able to be very fluid and flexible, and we are leveraging this to help drive our quality improvement. We do have weekly staff meetings where we can discuss new ideas and revisit our ongoing changes and improvement projects. We have some monthly agenda items such as HIPAA, clinical quality measures, and meaningful use reporting, and every week we discuss current issues and any changes we are focusing on at that moment. As a small practice, we are able to make adjustments to our proposed changes easily as we determine what is working and what is not. Essentially, we can conduct many small trials of change. While we sometimes use a formal written PDSA format, often this is done less formally and more creatively or naturally. This approach works well for us. We've heard that other practices may have staff members become leads on different projects. Our team prefers that I act as the main coordinator or leader for all of the changes, but they all contribute input and suggestions as we test them. Often staff want to know the rationale or the why and also what the options might be, but they don't necessarily want to be responsible for the organization and tracking. So for us, it works to have one leader or change champion for each project, and most of the time that is me. If a change is not working, I bring out the Managing Complex Change tool and try to identify what might be missing. First, we need to identify the reaction or the emotion that the change is inducing. So, for example, if I'm sensing a lot of anxiety from an individual or from several staff members, it could likely be due to a lack of confidence in a needed skill. So we increase training and skill building. For example, one of our APRNs struggled with his diabetic CQMs in the beginning, and it created significant anxiety for him because he's an exceptional practitioner and had very high self-standards. It quickly became clear that additional one-on-one training was needed regarding exactly what the CQM rationale was, exactly how our EHR required it to be recorded, and who would be the one to record it. The workflow knowledge was what he needed. The provider needed a more intense, focused training, which allowed him the ability to better understand the end goal and how we could achieve the end results we were aiming for. So the Managing Complex Change tool is a helpful tool that I use frequently to dissect specific changes that aren't working as planned. I would like to share another tool that we use frequently with the staff. I call this taking the temperature. This tool was introduced to our practice a few years ago when I needed assistance with creating a positive change environment and with change resiliency. We were struggling with implementing many large-scale changes at the same time. Our consultant walked us through this tool together, and now I bring this back to the staff as a whole every once in a while, or more frequently with an individual who might be struggling with change fatigue or particular change. Sometimes we find that staff might be still in the chaos area because they weren't part of the research or the development of a particular change. Since we have all experienced the positive end of this bell curve, or the success in the commitment phase, this tool is helpful to not only take the temperature at a moment in time, but also serves as a visual reminder of the great outcomes and the feelings associated with success. Sometimes I will schedule a one-on-one time with an individual who is struggling more with a change, then keep checking in with that individual for a few weeks. During these times, I can support them and also hear more input and potentially adjust or improve the change we are working on. Having these visual tools helps us have real, focused conversations about the change process itself and helps acknowledge that this is an important process and not just work for the sake of work. One of the lessons that we have learned over the years is that you need to focus on improvements, not on perfection. I've heard that saying that perfect is the enemy of good, and this is most definitely the case with continuous quality improvement. We realize our large achievements come from many small incremental changes. So, for example, we celebrated our successful re-recognition as an NCQA PCMH Level 3 practice by recognizing all of the hard work that was required to meet all the small goals. We believe that rewarding hard work and improvement is important, and while we can't always do this with monetary incentives, we can find creative ways to give rewards and to have a positive, healthy work environment. For example, we recently held a Cinco de Mayo party at Dr. Brownfield's home for the entire staff to enjoy a reward and spend social time together and a giant cake. I have another mantra, and that is make the EHR work harder so you don't have to. One of the great things about quality improvement is that we are trying to make things better and more efficient, trying to reduce the workload so that we can spend more time on patient care. If something feels burdensome or time-consuming, we need to step back and look to find a way to do it better or to have our HIT do part of it for us. I'm a big proponent of setting up monitors in the EHR. This not only captures helpful data for you, but it also means that you don't have to concentrate on everything at the same time. If you can create very specific reports and monitors, they are essentially conducting tracking for you, and you don't have to watch over everything at once. When an issue arises, then you can focus on that matter. Even with all of these tools and strategies, we still all experience change fatigue at times. We have learned that it is important to identify signs of fatigue and not to ignore them. I always listen to questions and complaints about a change or a process. Sometimes they signal fatigue, and sometimes they reveal that something just isn't working. Both are important to recognize. During a staff retreat that focused on QI work and processes, we put a decorative jar at each staff member's desk area with blank strips of paper. We reminded each staff member just how valuable they are to the practice. We acknowledged that some days we may just feel overwhelmed, frustrated, or tired. Each staff member was asked to write something that they appreciated or respected about every other staff member and place it in their jar. The goal is to refill their bucket for those days when they seem to be drained. This seemed to be a very encouraging activity and a good way to really show our value to each staff member. One last lesson that we've learned is that it is important to take breaks. This can be an actual break, such as time off or a vacation, or a break from sweeping changes. Occasionally, we'll take a quarter where we intentionally do not make any major changes, but just let our monitors track our current work and maintain the great changes we've already put in place.
We'd like to thank Christy for sharing her practice's remarkable work in this area. Before we conclude this learning activity, I'd like to review some of the highlights from this presentation. Anytime a practice is attempting to make change, it's important to recognize change fatigue and the fear of change. Be it internal to the practice, to different payers, to the hospital system, or simply to medicine in general, there are a lot of changes facing practices right now. It's important to recognize that constant change can be very unsettling over time, and I think it's sometimes important to take a break and step back as a way to address that change fatigue. A particularly strong thing Ms. Brownfield described today is to communicate that the purpose of your change is the actual improvement itself. When employees are facing change fatigue or fear of change, it's important to recognize that the goal is not simply to change. The goal is actually to improve our outcomes. As a small practice, Harrison Family Practice has done a great job of highlighting the importance of communication. While we tend to focus on formal communication methods, in small practices particularly, informality can be equally effective. Ms. Brownfield's mantra of "make the EHR work harder so you don't have to" is an important one in supporting change within a practice. By leveraging health information technology to accomplish part of the work of quality improvement, namely the measurement, Harrison Family Practice has been able to take some of the challenge off of its staff and let them focus on the patient-facing aspects of their improvement. Thank you for watching Creating and Sustaining an Excellent Culture of Improvement. We hope you found this presentation useful and will take the time to watch other videos in this on-demand series.